And then the third is healthcare delivery in Malawi, which is going to be brief because we've sort of highlighted the healthcare system delivery in units in module 1, right? And the last one is ethics in development. So the theory of healthcare demand and supply. By the end of this unit, you should be able to first examine the factors that determine the price and the quality of healthcare. The second, describe the factors determining healthcare service demand. And the third, discuss health as investment and health care supply. So, healthcare demand, you were still writing? I'm going to send these to Ndekamalisa. Yeah, so you can just take down notes maybe to assist you in what, especially when we are going back to ask what are the areas we covered. So to introduce, healthcare demand is responsible for having more expensive systems than in any other place. So what this means is that healthcare demand is expensive than many of the other sectors in public life. So why is the price of healthcare higher in one place than the other? So the question there is determining the differences in prices of health in various countries, right? To understand this unit examines the factors determining the price, the quality of healthcare, factors determining healthcare service demand, and health as an investment, and healthcare supply. So the factors that determine the price and the quality of healthcare. So we are learning, is that micro development economics, right? Have you learned the principles of supply and demand?
Yeah, we learned
last semester. First year, you learned elements of microeconomics. I think even in macroeconomics, there are elements of price determinants of supply and demand as well. So the factors are the same, okay? The 5 factors are the main drivers of health pricing. First, demand. Demand determines price, and supply also going to determine price. How compensation is determined, I'll be explaining that. Cost shifting, so we understand the shifts of cost that might be caused by other factors such as supplements, right? Complementary factors. So in health, we mean that the cost shifting might occur because of maybe different healthcare delivery systems. So we look at conventional Western medicine, right? And then we look at traditional medicine, and then we can look at Chinese medicine. So this can cause a price or cost shifting, and also pricing opaqueness. So demand. Demand, if you add, say, 10 million people in health roles, especially in the less healthy, demand for services and drugs has to increase. Unless there is slack in the system, prices would be expected to rise. So because there is high demand, it means so within the health system, it means there have to be more people who are working, right? And there have to be enough resources to cater for the various health ailments, right? So that drives up the price. As we know, conventional laws of supply and demand, high demand is going to cause an increase in prices because of the factor of supply. And supply, this upward price pressure can be lessened by increasing supply. So we said that demand the price responds to the high demand. But then in supply, we are saying that this upward price pressure that has been increased by demand can be lessened by increasing supply through, say, increasing the number of hospital beds, right? Fractioneer. So it would be like increasing the amount of hospitals, for example, right? If there are enough hospitals. So this is within the setting of if healthcare, from a Malawian setting, if healthcare was provided for, like if it was paid for, right, by patients. But public healthcare, normally people don't pay, right? Yes. So the supply can also be increased relatively by reducing the number of hospital days, right? Which is very important factor. You see that a lot of paying hospitals, they use this factor in trying to minimize the cost of healthcare by reducing the amount of days that people stay in hospital. You find that in a public hospital, if a person gets surgery, they're staying there for 6, 7 days. You know, in a private hospital, they would stay there a maximum of 3 days, unless there are complications, because they are looking at muntu jazi dandaula cost yazi, right? So we are saying there that in making a comparison means that there's some sort of inefficiencies in the government system, because it means they're just increasing the cost of healthcare. You know, they are using a lot more resources on a person, where if they had efficiently managed the patient, they would stay there for 3 days. Right? Yes. So you are looking at that cost in regards to the institution. The third factor is compensation. So how compensation is determined is that much compensation is based on fee for services, which creates a reverse incentive for providers who are paid for procedures and not for the outcome. I will explain that again. So much of the compensation of the person who is working, right? Payment of the person who is working. So we are saying that a payment or compensation of the person who is working is a fee for a service, right? If you go to the hospital, you pay consultation fee, right? You pay lab fees, pharmacy, right? Which creates a reverse incentive for providers. This reverse incentive is saying that in order for me to do something for you, it means you must pay me, right? So because of this, people are paid for procedures and not for outcomes. What this means, this rate of compensation means, most of the times, people will just pay the doctor because they are getting assistance, but there is no evaluation in terms of if they are going to get well or not. See, ngati waji umavirabe kuti yes, and you are still going to get paid. And maybe there will be a very few people who would say, you know, at inenda bwera ndakandobwera kuno kumina katatu sindikuchani mungu nena kuti ndikudwala bet. A lot of people will still go to the hospital and maybe not express this concern that how is it that I've visited, you know, the hospital, the lab 3 times, and you're telling me that you still haven't found out what is it that I'm suffering from. So the reason there is because providers are given incentives for that service that they provide, as opposed to say if they were saying kuti muzati vasamukachira, right? So maybe people, which is obvious, it's impossible, right? But then if they said muzati vasamukachira, then kuti maybe they would work, you know, overtime to ensure that that person really gets the optimum healthcare, right? Or the optimum diagnosis as well as treatment. Does that make sense? Yeah. Okay. Cost shifting. So how compensation is determined is the fee for service, which creates reverse. This is the same thing. So cost shifting in hospitals, providers do not have do not have to charge everyone in the same the hospitals and providers do not have to charge everyone the same for the same service. That's the cost shifting, right? They don't have to charge everyone the same for the same service, which creates a system which some customers like federal governments, or maybe you can say insurers, where enjoy pricing that is often unprofitable, and others are charged more to make up for the differences. So to explain this cost shifting, right? Price discrimination. Sorry? Price discrimination. Not maybe we can call it that, right? From a microeconomic standpoint, we can call it price discrimination. But what it is, it's the shifting in ways where a hospital tries to make balances on the price. So I'm going to explain this in regards to the private sector, right? Because in the public sector, as we know, that they just provide the healthcare. But from a private sector, normally what happens in the health system is that palima health insurance right? So health insurance, every health insurance gives its price maximum on various services, and also price maximum on various resources at the hospital, right? So for example, mazim mtengo wake oti patient atolandira paracetamol is 2,000, right? And therefore Liberty ntengula ndi apanado uli pa 1200. Okay, and then there is the patient wa cash. Okay, mwina ukhuzuka 1500. So you are going to see that the hospital is going to charge according to the limits of the health insurance. Okay, and then you find that there are some patients that come in that they get paid by the government, right? The government is paying, like Malawi. The government of Malawi might pay a private hospital to assist the patient if you're not in ICU at Zaza, right? So they transfer that patient to a private hospital. So the government is going to pay the fee of that patient according to the price limits that the government pays. Do you understand what I mean? Service ndio mweyo koma ikusiana because of the one who is paying the cost, which is like the government or the various insurers. So we are saying that some patients enjoy pricing and some of them are charged more, which makes up for the difference. So the difference is what government, let's say ngarayi paracetamol kumulipira pa 700 komano muntu amazi muja see price maximum 2000. It means it's offsetting these differences. Does it make sense? Should I explain again?
It makes sense, but I'm not 100%.
What area did you understand?
Okay, government. You're saying from restricted way, also what we can consider what we either it will be charged more than the government. It's what limit are you talking about?
The limit that I'm saying is insurance companies, health insurance companies, they have maximum limits on the prices of getting a service.
Oh, meaning that they still get 1,700, not at 2,000.
Because limit yaboma, that's an example. The limit for providing paracetamol from the government is 700, right? So medical insurance, if you look at them, Uli Rovo, Uli National Bank, Reserve Bank. So I'm giving you the experience of what happens in private sector hospitals. So they charge. We say that companies are charged more. Okay. Then health insurance, and then somewhere there is muntu akashi, right? So service in the but then they are charged differently according to that, the corporate relationship or so on. You understand what I mean, eh? Okay, fine. So we can proceed? Okay. And the price opaqueness. So most providers, especially hospitals and surgical centers, do not quote prices in advance. That's a challenge, eh? You say, for example, women, most of the times it's very hard for them to come up with estimates, right? And most of the times they just say, no, the price is fair. What is fair, right? So even for the routine procedures, and most of the times even those routine procedures, they don't usually have estimates or quotations. So this makes it impossible for even the best informed consumer to make rational choices. So why am I saying this? I'm saying, I'm going to explain this in the context of saying the difference between hospitals such as Lilongwe Good Hope, right? And let's say Lilongwe Adventist Hospital, right? So if you as a patient, you say, I want to have a growth removed, right? Then ufuna hand operation, right? When we went to the same hospital and they found that growth, but then you are saying the cost of I want to sort of make an analysis of how much it costs it. So you go to Good Hope and say, so I want to have this removed, right? It's very unlikely most of the times for them to give you an estimate, even for procedures that are common. Okay, but yes, there's that price opaqueness in some countries, but in Malawi there's a standard for pricing. Okay, this is there because they're just trying to explain that factor, but in Malawi particularly, I know for a fact that there's a system in which there's standardization of procedures in terms of prices. If you are a patient at a particular private hospital and you want to get assistance in whatever, particularly the surgical procedures, they give you what is called a bill estimate, right? Yes. So they give you that bill estimate. ndikonzekere makobidi mwakuti. Yeah. That's the standard in Malawi. But in some countries, there is this price opaqueness where you never really know. Okay? Should I proceed?
Yeah.
So we have looked at those 5 factors, right? Sorry, that was the 4th, right? And this is the 5th, quality of healthcare, right? So healthcare prices are not necessarily the determinant of healthcare quality. Is that true? Healthcare prices are not necessarily the determinant for healthcare quality? Do you think so? It's a either or. It depends on the context. Yeah, it depends on the context. There are some countries like Malawi where, because the price of health, like in government hospitals, right? Because people generally don't pay and so on, so the quality of healthcare is not that good.
Yeah.
But I'll tell you, countries like South Africa, government hospitals, there is very good care. Even Zimbabwe, right? Because people there, they have this system of ensuring the quality health. The most quality services are provided by the government. Okay? Yeah. Agamana kuti kandi healthcare, kandi education, as the highest quality is the one that is provided by government. Yes. A private you highest quality is from the government. Yeah. And prices are sometimes determined by bargaining powers between hospitals and drug companies rather than the quality care supply. Okay? So we are saying there that the healthcare prices are not always determined by the healthcare quality, but rather that healthcare prices exert a significant influence on healthcare products. Right? So generally the drug companies make an assessment of the viability of the prices that they have on drugs, right? In relation to the competitive products, right? So my company nambi imbira wabanga banana, right? So they need to make a regulation. So you understand the concept of competition, right? Perfect competition and so on. So this is going to determine the prices within the healthcare and quality of that healthcare. And with people, healthcare services need to be likely to be inelastic rather than demand. Is that true? There's price inelasticity in demand of healthcare. Do you know what price elasticity is?
Yes.
What is it?
The maximum.
Unama.
Okay, I think we have an idea of it, but we don't know the
Price elasticity, right? And then there's price inelastic, right? See,
Yeah.
and then the other one is like this, right? Where even although, so, excuse me, price inelastic means even when prices are increasing, it doesn't affect the demand, right? And then even although prices, sorry, no, this is price elastic and this is price inelastic. In this one is inelastic, this one. Price inelastic, right? Okay? I think I remember this. These are the curves of price elasticity and price inelasticity. Okay, so it determines that for this concept that says that the healthcare within the service is likely creating an inelasticity of demand, where so what that means is to say that even although there is that increase in price, there is the inelasticity of demand because people are still going to have to access healthcare. Okay, so it doesn't matter how high the prices are. And to yes, right? The only difference there is that generally the competitive factors, a person would choose to go to a cheaper hospital than opposed to an expensive hospital because the illnesses are there still. So inelastic demand is not in itself a problem for competitive markets, but demand by consumers who lack supplies information. So the demand of consumers who lack supplies information looks at the determinants of the quality of the healthcare in terms of the information that you have in regards to a service provider. Right? Do you have information in regards to a service provider? Muntu akhoza okunamiza onayo kuti at 12 amapeka treatment yabuno komanso they are good prices, right? But then you've never really actually gone to the rest of the hospitals, right? So you can only make that assertion if you have experienced the rest of the hospitals. And this assumption makes for the price inelasticity of what? Of demand. Yes, because a person is still accessing healthcare at that particular place because they don't have relevant information in regards to other service providers. Moving forward, so quality healthcare services can be achieved through investment in the following: various trained professionals, which is true. For the quality healthcare to be provided, it means that they are well trained, right? And as general practices, specialists, nurses, medical technicians, pharmacists, and many other. So this is an important factor when you're looking at treating within the medical profession, where people are trained in different fields of the human being. Alingati muntu wa IT, muntu wa hardware amasiyana ndi muntu wa program, right? Yeah, so it's generally, for me, that analogy makes sense for me, right? Because you are looking at the specialization of maybe one particular thing. And also invest in procedures and testing, right? So why this is important when you're looking at procedures, where what procedures have been employed to ensure that a patient experiences the maximum healthcare delivery, right? Akabwera muja, what happens, right? They meet Kandani and then they meet the doctor. Do they go that? Okay. So it's more like of a system of diagnosis, right? That is the procedure. And the second is the testing. Investing in good testing machines like the magnetic resonance imaging, the MRI, the laboratory analysis for blood samples and so on. Because for you, like if you are sick, you go to the hospital and they tell you that machine you get put off, eh? Yeah, you'd rather go to a hospital that is going to give you all the services. Or even if they tell you that you know, you get put off. So I would give you an example of, like, for example, Maiwatu, right? Maiwatu has got like a lot of specialists. A lot of them, they are not employed by the hospital, but then they come as consultants. Right? Patient has got that illness. It's, you know, they just call that consultant to come and see the patient, right? As opposed to when you go to a hospital where they tell you, they don't even refer you. Yes, we don't have this doctor, but you know, there are these consultants that you can meet. You know, you get put off by services like that. And hospital and nursing care services. So there are various hospital and nursing care services, emergency services such as ambulances. Panova Mazim has invested in ambulances, and pharmaceutical products. It is always imperative when you are looking at procedures and testing where there are enough and good pharmaceutical products, right? Good pharmaceutical products. So it is within the efficient treating of a illness. So supply of quality healthcare can also be a problem, right? We have looked at the aspects of the healthcare, looked at the investment of the healthcare, and then we are trying to address the fact that yes, the quality healthcare is there, but then sometimes the supply can be a problem. So some healthcare suppliers have significant market power. Do you know that? Some healthcare suppliers have significant market power with insight from supply and demand viewpoint. They have that significant market power in terms of determining prices, right? For example, prices of pharmaceutical companies, right? They can determine because they have, like, we can say, relationships with such people, right? Not like that. What I mean is, two different hospitals, one can have influence on the market because they have networking relationships with the suppliers of maybe medicine, right? You understand what I mean?
Like, same, clinics will be same. These are private.
Yeah. They have good relationships with them. Mwina amagulisa bwino, zindu amagulisa, mwina polipira amalipira ntaya bwino. So, those are factors that would determine a buyer and a seller's relationship. So, and furthermore, you are looking at supply of also healthcare professionals. So, there are some hospitals, private hospitals, ukakhona kuti umagwira ntchito kumene kuko. And you're applying for another job somewhere, they are not going to employ you. Yes. Not just in healthcare, in a lot of even in banks. If you have, you are a current employee of that company, they are not going to employ you because they are trying to maintain my relationships. I'm not the so the other company has got an upper hand. Okay? Yes. It's there in a lot of fields. Yeah, so including healthcare. So normally, some healthcare suppliers do indeed have significant market power with insight from supply and demand viewpoint, but it is trickier to compare prices of healthcare across countries, right? It is difficult to compare because countries generally have got different policies, right? Yes, and they have different systems in acquiring of healthcare services, maybe prices of not prices, but we can say wages, right, of their employees and so on. So it's very difficult to compare that. And the differences in the market power need to be considered. So you are looking at the differences in market power between countries as well, right? So there's a policy by the SADC that SADC countries do not poach healthcare workers from one another, right? Because generally, the problem is that we need a lot of healthcare workers, right? So, and it affects the patient healthcare ratio. But then there are now these policies, for example, the World Bank came in with the loan that they gave the country to say that they shouldn't employ a lot of healthcare workers, a lot of teachers. Right? That's the reason why pakati mavizura anthu abanga graduate ma teachers yet my healthcare workers kumasanalimbidwe ntchito ndi boma, right? Because they are one of the policies. So in explaining of this is normally when people like nurses and doctors or teachers graduated, they just have to get automatic employment with the government, right? Komantai zina makondi boma libe maisoso zinoti abange adi payroll. Okay, because it's a lot of money, the government paying. Yeah, so one of those policies where when we get loans from the World Bank is and patient ratio doesn't really matter. So it has created a laxity in terms of nurses or doctors that can leave the country, right? And various healthcare workers. So the bigger problem is that some healthcare suppliers, such as hospitals, are either government controlled or non-profit institutions. So this is a primary factor when you're looking at the quality of healthcare, especially non-profit institutions that are just providing the healthcare to provide good services and not necessarily to make profit. Okay, so it is irrespective of how much the resources used, how much they cost. Okay, they're just doing it to provide services. So we can give an example of institutions run by Clinton Health Access Initiatives, and there's Bill and Melinda Gates. There are some institutions that are run by them, and then there's EGPAF, there's Lighthouse. They are non-profit, they are government funded. So, it's run by Lighthouse, so even Uganda services. They are very good services. They have a machine, so you can't really determine those costs because they are just providing them because it's project based, and not necessarily because they are trying to make profit. And quality of healthcare improving is a continuous process. So we understand that. So when you're looking at quality of anything, it's always a continuous process. Generally, at whatever level that you are in, you always end up finding issues within your delivery, right? And you want to upgrade the way that you provide that particular service. So, sorry? Oh, that there was someone outside. Okay. So healthcare is insufficient if care is to be accomplished as a goal of continuous improvement. So an important note is that due to information problems for households, market power by suppliers, and government interventions, the market for healthcare cannot be analyzed by using standard supply and demand curves. Okay? You see that point there? After the important note. Yes. Due to informational problems for households, market power by suppliers, and government intervention, the market for healthcare cannot be analyzed using standard supply and demand curves. Because no, okay, no, it's not the market failure, but we can say that there are inadequacies in enough information, firstly, and there are also interconnections between the market power by the suppliers and also the government intervention. So these multiple factors, you never really know the combination. It can be government intervention or problems with the household information, or it can be market power by suppliers and government intervention that is causing it. So because of these irregularities in combinations of these factors, it causes a difficult mechanism to analyze the supply and demand of healthcare using the standard supply and demand curves. Because standard supply and demand curve, there's the first one which we just use price, right? Which causes we can say a movement along the demand curve, right? Which is price. And then we have the one that are caused by non-price factors, which causes a shift in the demand curve, right? You remember? Okay, so because those are the standard in supply and demand, it is very difficult to use that in regards to say the healthcare supply, because we are saying that the determinant of supply is not just the price only, right? We have issues such as the government intervention, the market power, the suppliers, the effects of healthcare in terms of those that are provided by non-governmental organizations. So it's very difficult for you to make an analysis on demand or supply of the healthcare. I don't know if that's making sense. Okay? Yes. So it's good that I gave an example of traditional supply and demand curves and you remember it. Yeah, so it would be difficult to use that with healthcare. So spending on healthcare today has an effect on your health status in future. That is true, right? And for result, they are paying medical insurance a lot of money because they are looking at you go and you want to get access to a very good hospital, right? Because you are looking at because the issue is you have money, right? You are paying healthcare, also you are looking at the availability of a lot of resources in a private hospital. So you know that when you're investing in your health, either it's provision of a healthcare service or provision of proper nutrition, supplements, exercise routine, and so on, it is regulating your ability to have a healthy status in the future. So in that sense, this spending is an investment. Okay, this is where health as an investment is coming in. Okay. Nanga, the way it says that like your parents, they are paying school fees, right? They are investing in you. They are investing in you. Kuti in future, mwana yaza ndigwira pankono. Mukuvomera? So the demand for health services, like other goods, depends on your income, right? The demand on health services, like other goods, depends on your income. So we are saying this in regard to say the demand on we can say the quality, or maybe yes, the quality of healthcare depends on your income, right? One person can access a Mazim hospital, the other person can only access Cham hospital, but they are all demanding healthcare, right? But the factor there is how much money they have to afford the healthcare that is being provided for, and the price of the services. So unlike your demand for many other goods, your demand for health services is influenced by the cost of health insurance. Does that make sense? Your demand on health, unlike other health goods, it's just drama yangu bitoka gulomeni, but this statement is coming from the traditional healthcare provision in regards to health insurance. Okay, for public hospitals, the assumption is to say anyone can access it. Right? But even in private hospitals, munamva kumakha kupaying, right? Kupaying public hospitals kumakha kupaying, right? Even kupaying kuja mapeza kuti treatment yako kumene kuchakusiyana ndi kujani unanipaying kuja, yes. Yeah, so there are a lot of services. So it's going to determine a lot of factors. So your demand for health services is influenced by the cost of healthcare. You are only going to demand healthcare services in regards to how much you have to pay for health insurance. Okay? What that means is health insurance mazim panoba executive ilipa 26,000, okay? Per month. You are more inclined kulipira mazim 26,000 per month because your demand is dental, right? Dental care, because you have problems with it. For one kuti ndipita kuchipatala kuja ngati a private hospital, they should assist me with my teeth. It's going to cost me more than it would cost me on mazim to pay for entire year, which is 250,000. Kwa kupita kuchipatala kuja ndoti consultation fee ulipire. You know, dental care is expensive, gunda 1 million plus. So you feel like the healthcare service or the health insurance that you have regulates the price of health insurance that you have is the one that regulates your demand for the goods and services. Okay. And unlike the case for many other goods, consumers who demand healthcare services are relatively uninformed about the service they are buying. That is true, right? Unlike other goods, consumers who demand healthcare services are relatively uninformed about the services that they are buying. Because the difference is when you are, first of all, when you are buying health insurance, right? Monthly basis, right? You're not really sure on the type of service that the insurance is going to give. Timanoti insurance cover, right? Abanga cover to what extent, right? You are not really sure. And you're not going to pay anything. But then you go to the hospital and you realize, so health insurance, as I said, they have limits. There are some medications that are not covered on that health insurance. You go there, in a health insurance, I don't pay anything, yeah, but this medication is not covered on your scheme. You know, you hear something. When you were buying, you really didn't what? You didn't know. They didn't tell you all those things. And the second factor, you are looking at demand of the health service itself. Okay, you are really unsure of how well a hospital is going to treat or firstly diagnose and also treat your illness. Right? So this comes in 2 points when you are looking at you not having knowledge, and secondly, when you have access to the information by people who have access to the service. You hear things like that. But then most of the times people will just access the healthcare because when you are sick, you are desperate, right? No, you just go to the nearest health. I'm on Mazim, this is the nearest hospital for me. Most of the times people don't really know about the wellness of the healthcare that they're going to receive. You have to be paying monthly. That's what insurance is. But then they just go to insurance, they don't even receive any other. No. Oh, you mean as in a Mazim hospital? And then there I can just go run to visit and I'll pay. Later? Kabena, you pay cash. Oh yeah, any hospital can help an individual as long as they are sick. As long as you're going, if that hospital is a paying hospital, right? Yes, you can access. No, it's not like that. It's against the policies of healthcare provision, right? Yeah. So that includes even accidents. You are aware that when you have an accident, any hospital that is the closest to you is supposed to provide the emergency health care to stabilize you even when you are not going to pay. Yeah. So para kochi para chiri hapo wina aina akautandiza otherwise umakhamu land, right? Yeah, they can. And actually, the healthcare providers know that kuti tisathandize umakhala mulandu, they can, they can revoke your license. Yeah. Yeah? Yeah. The production function of health takes inputs such as doctors, nurses, machines, produces and produces healthcare services. So patient satisfaction is multidimensional healthcare construct affected by many variables. We understand that is an important factor when you're looking at patient satisfaction. Yet they are looking at all of the services that they have been provided for, including the medication, all of those. Healthcare quality affects patient satisfaction, which in turn influences positive patient behaviors such as loyalty. A patient satisfaction and healthcare service quality through different to measure can be operationalized using multidimensional approach that combines patient inputs as well as expert judgment. So this concept looks at in private hospital makati wa quality assurance. Okay, kapena patient liaison officer. So this person is partly marketing, right? Who dives into the research of what patients, determine as quality service, and they try to incorporate those within the service delivery of a private, particularly private hospital. Because let's be honest, in a government hospital, even it's not going to change anything, Yes, there's nothing that is going to happen. Yes. And quality healthcare is a production of cooperation between patient and the healthcare provider in a supportive environment. So personal factors of provider and patient and factors pertaining to healthcare organization, healthcare system, and broader environment affect the healthcare services. So there are various factors, the healthcare system. So when you're looking at the healthcare system, you'd be looking at the system in Malawi, for example, in provision of healthcare, right? So every hospital in Malawi must follow the Ministry of Health policies, right? So pena imatono the policy, your Ministry of Health is insufficient, right? So it's going to affect the healthcare delivery. So you'd see that if we were trying to differentiate the healthcare delivery system in terms of, let's say, Malawi and South Africa, right? Pitani kuchipata cha boma South Africa and umatono kwani kwanza tulizote, you go to the US or kapena you go to the UK or even you go to China. I recently saw a documentary on the patient experiences in China. You go to a hospital, public facility, zinda nditu wachipatala. You go there first level, you have to scan QR code to meet the doctor, right? You go in there, you are never really guaranteed that you meet the same doctor that you met last time, but they are good facilities. And then they'll tell you, let's say, to go to the lab, right? When you go, they order that amangoba sleep. So there are these, they have advanced technologies now in China, right? As opposed even to the UK and even the US. Yeah, Chinese countries are very advanced in their machinery. So you scan QR code to make payment, right? So masiku ano the phone, no touch, just use your phone app. It goes in drama kumene kuja. It means you go and access to the lab. You go there, they'll draw your blood, and then so you can imagine in a public hospital like such as that, could maybe 1,000 of patients. Don't you makaba line? You could magaza right? And then when they are out, it calls you a notification. Ndoto magadikira ba waiting area, number imena kupasa ija, it calls you out, and then you scan the QR code again, it prints out your it prints out your result. So you are looking at these differences in the healthcare system. A person who is Malawian and a person who is Chinese, if let's say we just exchange and experience these things, it will be different for us. Yes. And healthcare quality can be improved by supportive visionary leaders, proper planning, education and training, availability of resources, effective management of resources, employees and processes, and collaboration and cooperation among others. So collaboration and cooperation is very important when you're looking at healthcare, especially underdeveloped countries. We don't have enough resources, and sometimes we are lacking in skills. So within the principles of global health, they sort of exchange my healthcare workers to gain skills in various countries, to gain skills on various service delivery mechanisms. Any questions so far? Okay. Factors determining healthcare service demand. Factors determining healthcare service demand. So as stated earlier, quality consists of a degree in which healthcare services for individuals and population increase their likelihood of desired health outcome. So this is very important when you are looking at a healthcare service. So this statement generally means the standard quality of healthcare service normally determines the outcome, the health outcome of an illness. I'll give an example of ARVs. So the ARVs that were present when HIV was just a new phenomenon, the ones that were being received by African countries were the least quality medication. Nanga I feel nanga we were not contributing to anything in production, so we just received dizosalila zija. And you found that a lot of people experienced a lot of adverse reactions to my ARV. They were disfigured, and a lot of you can see someone you're like, oh, HIV and it's not the disease, it's actually the medication that has caused that issue. But then through the lot of changes, you find that people now are experiencing better health outcomes with HIV because there is better medication. And as a matter of fact, which is for free, but you can actually buy ARVs, right? Right? Yes, there are ARVs that are expensive. There's that injection for once a month. Basi, once a month, and then there's another one for once every 3 months, right? But it's expensive. That's the point. It's expensive. So the point that I'm driving at is the outcome of the illness. Medications that are that expensive, they sort of cover a lot of the issues that come with the illness, right? People who are on that medication, most of the time, like the partner, if they are HIV negative, they will not transmit to the child. The positive outcome of the illness, that person is HIV positive and so on, right? So the successful health organizations, which includes hospitals, physicians' offices, pharmacies, and so on, will be understood, identified, and put into practice all the following essential principles. The first determining health service factor is leadership. Why do you think leadership determines healthcare service demand?
Just how they do in their hospital, like how you said, we didn't just the last one.
So you are looking at leadership because the leadership is the one that sets the ground on all delivery or a provision of the healthcare service, right? And also mechanisms as well as procedures within the hospital. If there are no good leaders, the other thing is it affects the motivation of staff, right? For a leader, according to staff are demotivated and it affects how they provide services. That also includes the efficient use of the resources and so on. And the second principle is measurement. So measurement looks at measuring the satisfaction, right, of the healthcare delivery system, right, by the patient. So what measure are you using to determine the satisfaction of the healthcare that you're providing? So the measure is between the healthcare provider and also the patient, right? So it is, sorry? Yes, it's both. We are saying it's both the measure between the healthcare provider and also the healthcare or the patient. The reason is we are measuring as a healthcare provider because there is standards of practice. within the practice, right? So I'm saying this because it's different in other service delivery where, for example, waku bank, yes, mukafika wamene pajapa, maybe you want to cash out money, ndio ungolemba zinthu ngazinezita, eh? Komanso even there's sort of a measurement because munthu sangakupange cash out money without giving them proper details. Muzaona ubanki kuja ukakhala kuti ID ulibe, amakuza unodikirani kaye tasayinani apa aone kuti signature imene ili mu system ndi dzina imene ukutchulayo zikufanana, right? They have a system of ensuring that at least there isn't fraud, for example, in an account. So this measurement is in regards to the policies and procedures within a hospital in regards to patient treatment, right? Patient akabwera, right? Timapanga bwanji. So a very good example in this measurement would be you were saying something like I'm at first come first serve, right? This is not a good measurement because you are looking at the severity of an illness, right? It means a hospital is not using proper measurement skills in terms of assisting of healthcare, right? And in the very same example, patient you use a measurement skill yantu where afuna kuti iye athandizidwe nsanga kusiyana munthu kuti wavulala kwambiri, right? And the second is reliability. So reliability is across different mechanisms, right? A person can be reliable because they are always going to be available to provide services in the most optimum way, right? So the healthcare service is demanded because they are reliable. Ukapita chipata umapeza unoti anthu aliko, right? Sikotseka mankhwala mukapeza alipo, kulabu ukapeza so anthu ndokwanira, and so it will get you through going into the hospital and going out, and all the services have been what provided for. And we have practitioner skills. So among the demand there, the practitioner skills is some sort of a reliability of a healthcare system, right? Because unotupita umene kujako adokotala aja kukhanga ati dikirani kaye ndafuse kaye. What trust would you have with that person? You know, you sort of lose trust. I mean, okay, fine. When you go to the hospital and you find a young doctor, what level of trust do you have? I'm a chito leader. So you know, so those practitioner skills, it's looking at sometimes in terms of age, because you are looking at do they really have experience? Can it experience? And the experience, yeah. I would have a drip and SEO. And the bag 5. They're not really experienced in putting an IV. Oh, you mean as in, okay, fine. So normally when you are putting an IV, you have to stop blood flow. Ndamamanga and the glove. So I don't think it was, maybe it was 50, I'm not really sure. Anyway, yeah. Well, I don't think it's more than 15 minutes. Okay, it's not good if 50. Anaiwala nesiwo. Amaya anaza zindikira later kuti mwana itamuona anitu. So this is what happened. Okay, I don't really know the whole story, but according to me, this is what happened. Anamanga amawesa awese awiga dripi ija inakaniga ananyamula zinthu zake zija dripi ija osayika nkuisi ya gravu popo waiwala kuti gravu ija ibati komano organize munthu akumutsa asati mina chiwene ukhala anesi anamuyika mwana ijiji sanga they don't really know alimuna ndimezi maine akukhalira so and then the later child, the mother was mkono wa mwana atu it wasn't after 50, it must have been longer. Yeah. So mwana uja basi, you know, it happens.
I bet they were compensated.
Yeah, they have to be compensated. No, because she's training. He or she was training. So normally
they give them room for mistakes.
Yes, they will give them room for mistakes. Yeah, but generally it is much these means there's room for mistakes. So practitioner skills is very important. Yeah, so generally when you're looking at healthcare delivery or healthcare courses, it has to be a person who is pays attention to details. That's okay. So I told you that I've been in healthcare. In nursing school, you can't get below 80%. In the school that I went, right? In the school that I went, health sciences.
Oh, yeah.
So even I think UKCN, it's like I don't know, I'm not really sure, but I think it's a pass rate is not 60, it's above that.
Yeah, it should be.
Even in even in 75. A lot of courses across the world, yes. I don't know about other nursing schools, but I know across the world, medical, what they are studying medicine or nursing, most of the time, pass rate is 75%. What do you pay okay, and let me tell you something. So when you're looking at healthcare delivery, we use a standard of how you're supposed to assist a patient. Right? When you're answering a question, you have to assume that this is happening. So my points are that they have to be in order of how you are going to assist. If you have not written them in order, you have killed the patient. Okay, so I'm saying this in regards to the practitioner skills, because if they're trained like that, from first year, they pay attention to details and they're not negligent, right? So zikusiana with the skills. Sorry, the schools that a person attends. Some schools they are lax. Some schools, they are very. School I know, they were very strict. They were very strict. Amawida, so this is important when you are looking at the practitioner skills, because antamatadi kumupa muntu so unavyopa muntu upeza kuti umusoka patient so that's how you son. And we have the final one, the marketplace. So when you have the final one, the marketplace. So the marketplace determines the differences within the market structure in a country, right? The market structures in a country in related to healthcare delivery services different. I gave you an example of Zimbabwe and South Africa, where quality healthcare has to come from the government. Right? Yes, as opposed to my okay, so this is within the marketplace. What standards have been set in the marketplace of healthcare delivery services? Right? Yes. Furthermore, we look at supply and demand interactions that determine price of care. Supply and demand interactions that determine price of care. So recognizing that firms with market power set prices, right? Firms with market power set prices. So we'll regard that in regards of a hospital, for example, that has got mwana wao ndi minister of chakuti obanga negotiate these policies, they sort of create regulations and amaitozona kuti awawa ndaine yake boma basi, right? And they set prices of a lot of things. But unfortunately, healthcare markets differ. So it must be harder to get information about prices, but cannot simply walk in off the street and purchase an operation. So this is just regulating the types of we can say the estimates of prices that vary across different healthcare services. So one, in fact, can find out the hospital procedures and prices. For example, some websites allow to access information on hospital charges for different types of surgeries. For example, the cosmetic surgeries, Panopa. You've heard about medical tourism or surgical tourism. A lot of people are going to Turkey these days because it's cheaper. They have really good healthcare services, right? But they are also very good. They have really standardized prices. Kuti visa yote ngayopita kuteki ndiyo savuta. The healthcare there are reasonable prices. A person can pay cash. Yes. Okay, so when you are looking at this factor, the key characteristic in healthcare is that demand is relatively inelastic, where if one is sick and require healthcare, the service will be purchased at any price, right? You've seen muntu akuti wadwalika kwambiri. They'll get really sick, right? And family will come up and say kuti no tisonkhana apite kuchipatala, mwina apite ku India, eh? They really don't have money, right? But they are looking at maybe